Hello, I'm Dr. Shimon Tate, OBGYN at Indiana University Health. During this video, I will explain the different options for birth control. Due to the Affordable Care Act, insurance companies must provide contraceptive methods described in this video at no additional cost to you. To receive birth control, you simply need to see an OBGYN, family medicine, or internal medicine provider for a routine physical exam. Women who have never been sexually active do not need a pelvic exam to receive birth control. Your physician can help you choose which birth control method is the best for you. The most common options for birth control include implantable uterine devices, also known as IUDs, birth control implants, birth control pills, and injectable birth control. To choose a birth control method, you should discuss the answers to these questions with your physician. Are you good at taking a pill every day? Do you have any medical conditions such as diabetes, migraine headaches, a history of stroke, or a blood clotting condition? Do you smoke cigarettes? Are you looking for a long-term birth control solution? Are you seeking birth control to help control heavy periods, acne, or other conditions? The most effective and safest form of birth control is an implantable uterine device, or IUD. The majority of women can use an IUD even if they have not had children. An IUD is a small T-shaped device placed in the uterus during a simple procedure in your physician's office. Though you may have some discomfort after the procedure, the feeling will fade quickly. You and your partner will not be able to feel the IUD. The IUD will not move once it is in place. There are two types of IUDs, the Mirena IUD and the copper IUD. The Mirena IUD releases small amounts of hormones into your uterus only. Mirena lasts for 5 years, though you can have it removed whenever you're ready to begin trying to conceive. For the first 3 to 6 months of use, you may have an irregular period. After 6 months, most women have no period or a very light period. The copper IUD does not use any hormones. It lasts for 10 years. Though some women experience heavier bleeding for the first 6 months, their periods return to normal by the time they have had the IUD for 1 year. Another long-term birth control option is a birth control implant in your arm, such as Nexplanon. This implant is a small rod that is placed in your arm at your doctor's office. You cannot see the rod once it is implanted. The rod releases hormones into your body that stops your body from releasing an egg. Birth control implants last for 3 years. Though you may have irregular bleeding for the first 6 months, most women have light or non-existent periods while using the implant. Another commonly used form of birth control is the birth control pill. The pill is only effective if taken regularly. Birth control pills carry a risk of blood clots for all women. However, there is a higher risk for women who have diabetes, a history of stroke, or women who smoke. Some side effects of the birth control pill may include headaches, nausea, elevated blood pressure, or a change in sex drive. Because there are many different types of birth control pills, you should talk to your doctor about finding a new pill if you experience a side effect. If the pill does not work well for you, you can also receive hormones through an injection every 3 months. These injections work the same as birth control pills, though most women experience irregular bleeding while using the injection. Do not stop using your method of birth control until you are ready to become pregnant. Though many people believe it will take months before you can get pregnant, in reality you may get pregnant very soon after birth control is stopped. Remember, the types of birth control described in this video do not protect from sexually transmitted diseases. To prevent these diseases, please remember to use condoms and obtain regular screening for sexually transmitted infections. If you have any questions about birth control options presented during this video, please ask your doctor. For more information, please visit iuhealth.org/birthcontrol. Thank you for choosing IU Health for your healthcare needs.